so many times we would get children that are very, very young and they'd all already have dental decay, dental disease. I guess I wanted to try and stop it before it got to that point. I've had to pull teeth out of very, very young children, as young as...
Our smile isn't just about teeth. It shapes our confidence, our health, and even how we feel inside. And in this episode, I'm so honored to be joined by Kym Shire, who is the founder of Smilecare Hub, where she shared insights about the benefits of oral health care for both parents and children. Because oral health isn't just about dental, it's mental too. So, without further ado, let's dive into the show. Hey guys, welcome back again to another brand new episode of The Round Table. Today I'm here with Kym Shire, who will get to share her story and educate us more about some of the things that we tend to ignore, but I won't give away too much, as I'd like for you all to stick around to hear what she shares with us today. But before we kick off, as always, the round table symbolizes a safe space where stories are shared, voices heard, and lessons learned. So pull up a seat and join me on the journey, because every story shared here matters. Kym,
Awesome.
Welcome to the round table.
Thank you, Tar. Nice to be here. Thanks for inviting me.
Absolutely, and thank you for taking the time to kind of share a little bit more about what you do. But before we kind of dive into that, can you just, for the viewers, just share a little bit about yourself and your background?
Yeah, sure. Well, I've been an oral health therapist for some time, over 20 years, and most of that time was spent working in the public dental system, school dental system. That's where I treated children for dental decay and just general checkups as well. And I actually broke my wrist in 2020 and decided to go back to university, and I studied to become a teacher. So I became a teacher, and when I finished that, I decided that I wanted to combine both professions somehow, and doing mobile dentistry has enabled me to combine the education side of teaching as well as doing the dentistry as well.
Wow, that's pretty amazing how it's led up to that. But I'm still curious about, how did you end up breaking your wrist?
CrossFit. So I was swinging on a bar, and just let go.
Well, okay, then.
Yeah.
Getting back to how you managed to combine the profession and your dentistry, what actually led you to create something like this?
Well, working in the school dental service for many, many years, and I saw firsthand how devastating tooth decay can be, and how many families were not aware of how it affects children in particular, because I worked just with children. I do adults as well, but that was mainly hygiene side of things. But for children, it's doing dentistry, so looking at treating dental decay. And so many times we would get children that are very, very young and they'd all already have dental decay, dental disease happening in their mouths. And parents just a lot of parents accept that that's part of growing up and that it's okay to have a hole or two or to have a tooth pulled out from a very young age, and it's not okay. So it's, I guess I wanted to try and stop it before it got to that point. I've had to pull teeth out of very, very young children, as young as 3, and that's devastating, devastating for the child, for the parents, and for myself. It's very traumatic to do that, and so I guess I wanted to get away from doing that and going into early learning centres, which is what I do, and try and address it before it becomes a problem. So addressing dental decay mainly, so looking at children that are at high risk, and everybody in Bundaberg is at high risk because we don't have fluoride in the water. So because we don't have fluoridation, that means that we're more susceptible as a community to tooth decay. So children were coming in and I would see the effects of poor diet as well. Diet's a big factor, poor diet, and also parents not taking their children as early as they possibly should. So many parents do not know that children should have their first dental checkup by the age of 1 or when the first tooth erupts. So you're if you can get your children being seen by a dentist or dental practitioner early, you're setting them up for good habits for life. So it's a great opportunity for the dental practitioner to talk to the parents one-on-one as well and let them know, look, this is what you need to do to look after your child's teeth and keep them healthy. So not only is it just brushing, but it's also visiting the dentist and making sure that their children are seen regularly every 6 months to prevent dental decay.
There are some parents who would probably be scared to or come to visit you or visit the dentist at all.
Yes.
Because of, I don't know, maybe what they've gone through, they didn't think they needed to transfer that kind of information towards their children.
Yep, definitely.
Is that something you would see across the board with so many parents, or?
It's definitely a factor, absolutely. We have a lot of parents that are fearful of the dentist themselves, so they stay away, and a lot of people only go to the dentist if they have a problem. I think oral health in general should be seen as a preventative health service rather than a reactive health service, which it is. So a lot of parents have that fear factor of not having great experiences as a child themselves, and they instill that fear into their children. So before the children even come to see us, they have in their mind this horrible maybe picture in their heads about what it's going to be like, and they're scared already, and the parents are scared. So the parents don't take the kids. So yeah, that's definitely a factor, the fear factor.
Well, if you could point out something for the parents, what to expect, can you just walk us through? Because in the end, in the long run, it's to help the children too as well, and ease their minds as well too.
Yeah, absolutely. So with my service, we are a Smilecare Hub. It's a mobile dental service for children 0 to 5 mainly. So I travel around to mainly daycare centres, but I have started seeing people here at the Nest, which is a new community space. And it's not a dental clinic, so it's a welcoming space as well, and it's in a child-friendly environment, which is what going out to the daycare centres is like as well. So we're seeing children in their own environments. The children for their first visits don't have to go to a dental clinic where it might be, bright white and stark and smell and lots of unfamiliar people and lots of tools and, it's not a very nice environment. But if we can see children in their own settings, sometimes we will see children in their own little room while they're playing with their toys, and they can all get together with their friends and their friends can all be around them while they're getting their teeth checked, and it's fun. So we try and instill a bit of fun into the whole procedure as well. So it's not like a stark medical procedure as such as it would be going to a dental clinic or sterile dental clinic. We are sterile, obviously. We have to abide by all the health and safety regulations and infection control regulations and things like that, but it's not that clinical sterile environment.
Also, like you spoke about the nutritional side of things where some of the kids being affected by it too. What would it take to actually improve those areas, do you think? If there was an opportunity of some solutions?
Well, I think a higher tax on sugar, a sugar tax. So I think that would be a great thing to do. But I guess day to day, what families can do is just really be mindful about what they're giving their children to eat and trying to stay away from foods that stick in the teeth. So even some cereals that you buy that are probably everyday breakfast cereals that most children probably eat on a day-to-day basis can stick in the teeth. And the longer that the food is in the grooves of the teeth, the more chance bacteria has to cause tooth decay. So I'd say just be mindful of not giving your child sticky foods or foods that have fermentable carbohydrates, even packets of chips, like potato chips they're quite gluggy and can sit in the teeth as well. But obviously lollies and those sorts of things. But it's the other foods like the muesli bars and things like that people don't generally associate with being bad for your oral health, but they are actually not so good. So staying away from those foods. After each meal, rinsing with water as well, just to get rid of all the food that's on the teeth. That helps just to wash away those foods. Oral health has traditionally been seen as separate to the rest of the body. So, I guess it'd be great to see more integrated programs. So we know now that oral health relates to the whole body and can have an impact on your cardiovascular health, your respiratory health, lots of different things, diabetes, lots of things. So it's really important to try and identify. You can see a lot from someone's mouth to see what's going on with the rest of their body. So it'd be great to have more integration with health services and more sharing of information as well. So people getting out a little bit more and talking about oral health and bringing that awareness to the public, because it is sort of seen, I guess, because it's had this, people have this idea, I think, of dentistry and oral health as, it's too expensive, or it's not part of health in a way. It's quite different. It's sort of seen as separate, but I want it to be more like an allied health service, which it should be more seen as an allied health service. So just as you would go to have your eyes checked or your hearing checked, get your teeth checked as well, and it not be such a big, I don't know, it'd be nice to have it included in Medicare as well for everybody, not just for children.
Oh, wow. What, they don't include that with the Medicare system?
Not for adults. Only if you are a low-income earner, then you're able to access services at the General Oral Health Centre at the hospital. But for the majority of people, it's all out of pocket. So people don't want to spend money when they don't see the actual, or they can't see what the benefit is for their health. So the recommendation is to see the dentist every 6 months for a checkup and a cleaning of the teeth. But I would not say many people, the majority of people probably don't go and do that.
The other areas too would be some parents and that, or some families are financially struggling as well. Are there some things that could help them out for those that are struggling financially if they couldn't attend? Hey guys, thanks again for tuning back in. And if you're finding value in today's show, look, you know the drill. I won't have to keep asking you anymore, but I'd really appreciate it if you hit that like button, subscribe and share to someone that you feel could possibly benefit from what you've learnt about today's show. So without further ado, let's get back to it.
That's definitely. We're very lucky. We've got the Child Dental Benefits Scheme. So that's a Commonwealth government scheme that's accessible to low-income families or families that might be struggling. And the government will give them, I think it's just over $1,000 every 2 years for their child to have dental appointments and checkups, cleans and general dentistry. It doesn't cover orthodontics, so no braces, but if your child needs a filling, needs to have their teeth checked or cleaned, then it will cover those services. So it's unfortunately only, or less than 40% of people that are eligible for that funding are actually using it. So it's trying to get that message out there that there is funding there for people to access and use as well. So from 0 to 18 years old, eligible families can access that money.
How can they access it?
Well, if they go to their MyGov account, they should have a notice or a letter from the Services Australia to let them know what their eligibility, that they are eligible. And then when they go and see a dentist, the dentist will check, or dental practitioner will check their eligibility and let them know.
Oh, cool.
Yeah. So we see a lot of children during the daycare centres who are eligible for the Child Dental Benefits Scheme. So it's a really good way of seeing those.
I suppose
kids.
that's just where it comes down to whether the parents are aware of these systems. That can help them out in
That's right.
using it.
Yep, that's right. And I guess people's eligibility changes throughout the year as well. Or I think if their income might change, then they might not be aware that they are actually eligible for it within a certain period. So it is worthwhile checking MyGov account to see whether they are eligible, or phoning Services Australia and finding out for themselves, because they can do that too.
Yeah, cool.
Yeah.
So what would you like to see in the next 5 years down the track, hopefully, with what you're practicing and going around to all the daycares?
Yeah, for my business itself, I would love to expand a little bit into different communities, to be able to offer my service to more families, and I'd like to see more families taking up my service that are for younger children, so we can see children from 0. So that's really important to be able to talk to parents as well and let them know what they need to be looking out for their kids, oral development. So so I think mainly just getting more information out there for people so they can access the service.
And this is a couple of flyers we got here of yours.
So part of what I want to do is produce more information for parents about tips and things like that. So this one here is all about toothbrushing. So toothbrushing for under 5s. So it goes through like a little brochure, a little pamphlet about what to do, things like that. Some tips on the back as well.
Nice.
Yeah. We also have, we also have, I've just started an oral-facial myofunctional service. So with that, I'm looking at kids who might have breathing issues, so their mouth breathing rather than breathing through their noses, because everyone should be breathing through their noses. So we're just looking at, and that can cause a lot of dysfunction. So it can cause orthodontic problems. It can cause learning difficulties, lots of things. So I also have just started that as a separate service to my dental service. So it's quite a separate service.
I suppose before we kind of wrap up, any final thoughts?
I think if you are a parent of a young child and you're worried about taking them to the dentist or taking them to a dental practitioner, most dentists and dental practitioners are friendly, child-friendly people who will be able to, give your child a really good experience. And it's very important to try and overcome your own fears and not try and pass those on to your children so that the kids can grow up and have better smiles, healthy smiles.
Nice. And I suppose finally, how can they get a hold of you and where? So
people can contact me through my website. I have a contact page. It's smilecareHub.com.au. I think it is. It's on the back here anyway.
Okay.
It's on here. .com.au. So contact me there or find me on Facebook or Instagram. Yep.
Cool.
Yep, awesome.
I'll also add the details of the links and that in the description for this podcast. Kym, thanks again for joining me at the round table, and look, keep up the great work that you're doing, because I think a lot of the kids will benefit from getting a better understanding now than waiting for like what their parents went through and leaving it too late.
Yeah, awesome.
So thank you again for joining me at the round table.
Great to be here. Thank you.